everyone, this lesson will learn about age-related macular degeneration. Introduction. Age-related macular degeneration, we also call it AMD, is the leading cause of irreversible blindness in the developed world. It's a complex manifestation progressive disease with genetic and environmental influences. It occurs in people aged over 55. Current evidence suggests genetic susceptibility involving the complement pathway and environmental risk factors, including increasing age, white race, and smoking. The 10-year incidence among the white population is approximately 11.5% for early AMD and 1.5% for late AMD. Pathophysiology of AMD. The pathogenesis is still poorly understood. Degeneration of the retinal pigment epithelium linked to oxidative stress seems to be a crucial component. Changes in the branch membrane and formation of subretinal deposits are central to disease progression. Development of single or multiple areas of weakness in branch membranes allows the new vessels to grow through into the subretinal space between the retinal pigment epithelium and the retina to form a cortical neurovascular membrane. The new vessels leak serous fluid and blood, resulting in distortion and reduction of clarity of central vision. Visual loss results from prognosis of the degenerative process to the cell death and atrophy of the retinal pigment epithelium. AMD is classified as dry or wet. Dry AMD progressed to wet AMD in a minority of patients. The hallmark findings in dry AMD are drusen, and in wet AMD, a CNV can be seen. AMD risk increases with age. The risk increases more than threefold in patients older than 55 years of age, compared to the group of patients between 65 to 74 years of age. Other risk factors include cigarette smoking, genetic susceptibility, cardiovascular disease, hypertension, female gender, hypercholesterolemia, obesity, hyperopia, family history, and light irides. Symptoms include decreased visual acuity, insidious or sudden onset blurred vision, disordered near vision, scotoma, visual distortion, metaparsilla microscope. The hallmark findings of dry AMD: subretinal drusen deposits, focal or more widespread geographic atrophy of the retinal pigment epithelium, pigment epithelium detachment. Drusen are situated with branch membrane. They vary in size and space. They may be distinct or confluent. Histopathologically, drusen may also be detected as diffused subternal deposits, either basal lamellar deposits, formed mainly of collateral-based material, or basal linear deposits, consisting of granular lip-rich molecule located with branch membrane. Geographic atrophy. We can see the larger area of atrophy in the macula. Choroidal neurovascular vessels leaked fluorine was occultated late in the angiography. ICGA uses a dry with different absorption characteristic and can better detect central neurovascular vessels of AMD. OCT can be used to identify retinal edema and/or subretinal fluid and CNV. The diagnosis of AMD is typically made after considering a patient's age, physical exam findings, and family history, as many patients in early stages of the disease possess no symptoms. Ophthalmologic evaluation, fluorescence dye retinal angiography, photography evaluation, and OCT. Fundus ultrafluorescence. This new imaging technique allows identification of leukofucin accumulation, a sign of cellular metabolism and aging, and can be used to cataract and follow the progression of geographic atrophy. Treatment of dry AMD. Smoking cessation. All patients should be encouraged to quit smoking or avoid initial smoking due to the increased risk of progression to advanced age-related macular degeneration. Antioxidant vitamins and zinc. Antioxidants can be hypothesized to prevent cellular damage in the retina by limiting the effects of free radicals produced in the process of light absorption. Treatment of wet AMD. Effective therapies for exudative or wet age-related macular degeneration include intravitreal injection of VEGF and PDT. For most patients with AMD and neurovascularization, we recommended treatment with anti-VEGF drugs. VEGF plays a crucial role in the expansion of choroidal neurovascular membranes. Blocking vascular endocellular growth factor is beneficial for treating choroidal neurovascularization. A loading phase of 3 treatments at monthly intervals, followed by a maintenance phase of treatment as required. We call it 3-step PRN. PDT. PDT involves intravenous injection of the photosensation divetrons just prior to treatment with a photoactivating laser applied through the eye with a specific contact lens. Terminal laser photocoagulation is treatment should be limited to very small lesions outside of the central macula. Surgery. Surgical removal of the choroidal neurovascular membrane, macular translation, retinal pigment epicellular transplantation. Summary. AMD is a degenerative disease of the central portion of the retina and results primarily in loss of central vision. AMD is classified as dry or wet. The risk of AMD increases with age. Smoking is the major mortality risk factor for AMD. Treatment of AMD varies with the type. Okay, that's all for this lesson. Thank you for your attention. See you next time.